Now we invite Professor Zhenlin and Tang Jia to give us lecture. Zhenlin is President-elect of CSIT, President of International Exchange Committee of CSIT, is from Department of Radiology, West China Hospital of Sichuan University. Tang Jia, radiographer from Department of Radiology, West China Hospital of Sichuan University. The topic of the speech is radiation protection and infection control of mobile DR during COVID-19 epidemic.
Dear teachers and colleagues, hello. It's my pleasure to share with you the experience of mobile DR. My name is Tang Jia, and I am a radiographer in West China Hospital of Sichuan University. Today, my topic is radiation protection and nosocomial infection control of mobile DR during COVID-19 epidemic. The main content include the following three aspects. The first one is the current situation of COVID-19 epidemic. The second one is the most value of mobile DR during COVID-19 epidemic. The third one is the workflow about radiation protection and nosocomial infection control. As everyone is experiencing, the sudden arrival of COVID-19 is a war without smoke. Okay, let's take a look at the following data, which is the epidemic data on May 9. Here we can see in China, the number of existing confirmed cases is 355. However, outside of China, the number of existing confirmed cases is so large. Here we can see it's 236 million and 1,486. So the situation is still very green, I think. So why did the COVID-19 spread so fast and so widely? As we know, the novel coronavirus has high infectivity. It spreads through the mucous membranes of the respiratory tract, nasal cavity, and eyes. And the symptomatic infections can also be a source of infection. And the crowd is generally susceptible, and the onset of COVID-19 is hidden. Where does the mobile DR need to be used during COVID-19 epidemic? And this is the isolation ward, and this is my colleague. As we know, at present, the golden standard of diagnosis in COVID-19 mainly depends on the detection of nucleic acid. Imaging diagnosis include CT and DR, and CT can detect pulmonary abnormalities early and quickly. However, we know that the mobile DR is very important too, because it is difficult to move for critical ill patients in isolation ICU. Meanwhile, mobile DR is mainly used to evaluate the efficacy and the progress. Here, the important value of mobile DR during COVID-19 epidemic is very important. So here we can see the powerful mobility can help reduce the diffusion of infectious sources, and it can provide high-quality images, and fast imaging can monitor the progression of the lungs for COVID-19 patients in real time. And the low radiation dose of the mobile DR helps to protect the patient's radiation safety. And the vision exposure technology can also reduce doctor-patient contact time and then reduce the risk of infection for radiographer. Next, let's see the work system of radiographer. Here we can see the system of radiographer in our department. I roughly summarize it into the 3 points. The radiographer can just work in hospital and live in the isolation hotel, so I call it the 2-point first line work system. And there are 2 radiographers work synergistically in each shift, and shift 3 shifts a day. Radiographers was required to stay in the working area of the infection ward. Maybe you think the radiographer can just work in hospital and live in the isolation ward, isolation hotel. Even this would be very boring. But in order to ensure the health of the public, I think it's very easy. Here, this is the simple zoning map of the isolation ward area of our hospital. We can see that the green part indicates the clean zone, the yellow part indicates the semi-contaminated zone, and the red part indicates the contaminated zone, and the blue part indicates the buffer zone. Radiographers need to wear medical surgical masks from the moment they leave the isolation hotel, and there are full-time drivers to take them to hospital and return to hotel. And after entering the isolation ward area, radiographers were required to stand by in the clean zone. And when the doctor tells them that patient needs the chest film, radiographers then entering the dressing room to wear protective equipment and then start work. And this is the entry path for radiographer. The following is a detailed workflow of mobile DR radiography. I divided it into 2 parts. The first part is nosocomial infection control, and the second part is radiation protection. And the nosocomial infection control include 3 periods: before examination, during examination, and after examination. And first, let's see the 2 stages. We know that the protection of infectious disease in hospitals is divided into 3 levels: the primary protection, the secondary protection, and the 3rd stage protection. However, because the work area is the isolation ward area, we only focus on the secondary protection and the 3rd stage protection. And these are the materials we need to prepare. Here, let us see the dressing process of the 3rd stage protection. First, we should do the hand hygiene by the 7 steps. wear working cap, and then wear comprehensive self-priming filter type respirator. Wear the disposable medical protective clothing. Wear disposable medical isolation clothing. And wear the latex gloves outside. This is the whole dressing process. Secondly, we know that the mobile DR is the contaminated zone, so why we need to do the protection of the device? Because after examination for patients, radiographers need to complete the transmission of film, post the processing and other work, so it will take non-contact with contaminated equipment. Reducing the infection of equipment can reduce the risk of infection of radiographer. So the key points are the touch screen, the flat panel detector, and the cable contacted patients directly. We use disposable septic and membrane. Like this, the touch screen and all of the buttons should be encouraged completely. So as the FPD, here we can see the FPD is encouraged by the disposable medical tower and the disposable aseptic membrane. However, if the mobile DR used in your hospital has wire, you also need to focus on the cable that is contacted directly with the patient. In our hospital, there is a room for the mobile DR placed in contaminated zone, and it is for special use. Here, we place the mobile DR in the contaminated zone. And it's this room we place the mobile DR. And the following is the operation flow of us for mobile DR radiography. You can refine or change it according to your actual situation. First, we should check the information of patient and all doctor's orders, and then input patient information and set up the parameters according to the patient's body size. And we must do the hand hygiene and wear disposable latex gloves. Then we should place FPD on the back of the patient and then take off the outside gloves. I think this link is very important. Because it can promise the X-ray tube avoid be injected, and then adjust the predation of X-ray tube. Check again, and then ask all of the medical staffs to run away from the patients, and then make the explosion. After the exposure, we come back and check the image and finish the examination. And we will do hand hygiene again and wear disposable latex gloves again. This is the second time to do the hand hygiene and wear the gloves. So I last take out the FPD on the patient back and take off the outside gloves. Take off the aspected as membrane and then disinfect the equipment. And I think the key points is the two. The first one is wearing and taking off the gloves for 2 times and hand hygiene for 2 times. Second one is 1 membrane for 1 patient and 1 disinfection after 1 examination. We know bedside positioning is the key to get a good film. Therefore, we should adjust the position and direction of the flat panel detector according to the patient's position, and then adjust the direction of the tube. And radiographic positions include supine and recumbent, and all of them are the anterior and posterior body position. And the source image distance is about 100 centimeters, and it is positioned by the laser position line. And the center line is incident perpendicularly to the middle point of the connection between the 2 nipples. Patient's hands be placed beside the body. And according to the different positions of different patients, we need to give different relative angles as far as possible to reduce the patient's pain. And last, note the direction of the FPD to prevent the image from being flipped. And the details in prevention and control of nosocomial infection. The first one is to prevent mobile DR from touching the bed and some other contaminated things. A radiographer could put mobile DR in a special place beside the bed. It's best to assist each other by 2 or more radiographers when placing the FPD. And the third one is the flat panel detector should be placed on patient's back in an open area, which is away from the side with ventilator duct to prevent the corrector falling off. And the last one is when the medical staff are in close contact with the patients, we should help patients to wear the medical protective masks as far as possible. Also, try to avoid facing the patient's mouth and nose to reduce the risk of infection. And this is the setting of perimeter. The parameters is about the adult, child, infant, and newborn. And the adult is divided to 3 sizes: the overlarge, large, and normal size. And however, we can just adjust the kilowatt value according to the patient's body size. And it's worth to know that when there is a pulmonary consolidation or hydrothorax, we can increase the kilowatt value too. As we know, The COVID-19 patients would receive the chest radiography almost every 2 days or every day. So, in order to reduce the radiation dose, do the radiation protection is very important, not only for patients who were examined, but for other patients and for medical staffs. First, for patients, accurate positioning can avoid radiographic range is too large or too small, and we can estimate patient size accurately and select appropriate exposure parameters. And the neat protective clothing need to be used for covering the unexposed area. And last, the vertical neat screen was used to block the X-ray for other patients within 2 meters. How about the protection of medical staffs? Especially for some nurses who must stay with patients, need to wear lead protective clothing, lead cap, lead bib, and so on. In order to reduce the radiation, medical staff during exposure, a delayed exposure time for 7 to 10 seconds can be set before exposure. Medical staff can stay away from patients and avoid unnecessary radiation. And when the radiography area is in ICU 2 or ICU 3, the medical staffs can run away to the purple area. And when the radiography area is in ICU 1, they can run away to the red area. Here, I want to introduce the vision exposure technology. There is a built-in camera here, and the radiographer can see the image on the pad, and they can monitoring the patient, and they can do the exposure in a remote method. Compared with the conventional mobile DR, vision exposure technology can have several advantages. First one is vision wireless exposure. The second one is real-time monitoring, can be realized, and the patient status can be seen directly. If there are any problems, it can be adjusted immediately and exposed again to avoid exposure repeatedly, and this technology can improve efficiency. And it also can reduce the radiographer's radiation dose. It can reduce the contact time between radiographer and patient so as to reduce the risk of infection. Next, let's take a look at the disinfection of equipment and lead protective clothing, and how to take off the protective clothing. Here, we do the disinfection in this room, and after disinfection, we place the mobile DR here. The following is the most commonly used disinfectants, and the first one is the chlorine-containing disinfectant, and the second one is the 45% alcohol, and the third one is quaternary ammonium salt disinfectant. And this is a table of our department. We do the disinfection in the isolation ward area. And how did we do the infection detailed? First, about the surface of mobile DR. We can wipe on dictionary by using quaternary ammonium salt disinfectant with a concentration of 1,000 to 2,000 milligram per liter. And about the surface of FPD, we could wipe on dictionary by using 45% alcohol. And the radiographers must wear latex gloves during disinfection and cleaning. And in order to avoid the liquid entering the device to damage the equipment, please do not use spray to disinfect. And please ensure that the equipment is shutting down during disinfection. And I think this is the very important thing before we do the disinfection. And here is the disinfection about the lid protective clothing. We wipe on dictionary by using 45% alcohol or chlorine-containing disinfectant with a concentration of 40 milligram per liter. And the order is the 3 steps. First step is we disinfect the outside from top to bottom, and then change towel, disinfect the inside after hand hygiene. Also, it is from top to the bottom. And hang the lid protective clothing in the equipment cleaning room after disinfection. Also, we should do the disinfection with ultraviolet light for more than maybe 30 minutes. And last, disinfect the lid protective clothing every day. It's very important for other radiographers. And after the disinfection, we place all of these here, and then we can use next time. And this is the room for radiographers to taking off their protective clothing. This is the process of taking off protective clothing in third stage protection. Take off the disposable medical isolation clothing. Take off the outside gloves. Take off the disposable medical protective clothing. Take off the comprehensive self-priming filter type respirator. Take off the gloves inside. And do the hand hygiene again. Take off the working cap. And wash hands. First step. Second step. Step 3. Step 4. Step 5. Step 6. Step 7. And it's over. So this is the whole process of taking off clothing in the third stage protection. This is very important to avoid being infected. And this is the living path for radiographer when they leave the hospital and come back to the hotel. So we will do all we can when patients need. So I hope that our practical experience can help you as a reference. Welcome to correct and communicate with us. Thank you.
Thanks for your speech, Professor Li Zhenlin and Tang Jia. We know mobile DR played an important role in fighting against COVID-19. Also, radiation protection and infection control are equally important during COVID-19 epidemic. Thanks.